Insignia is a system that includes software for digitally treatment planning your clinical cases of orthodontic treatment, and based on this digital setup manufactures fully customized self-ligating brackets, archwires, and jigs for indirect bonding. It is an advanced bracket system, considering the level of customization it offers and the ability to visualize the final result in the three-dimensional setup. This has not only been valuable to me clinically, but also as a great way to differentiate my practice. From my experience, I have seen how Insignia has helped in making me clinically efficient, therefore resulting in shorter treatment times for my patient. Let's review what is torque compensation to understand how it is one of the keys to success of the Insignia system.
In orthodontics, torque is utilized to correct the buccolingual inclination of the teeth. The effective expression of torque is dependent on various factors. The rigidity of the archwire, closely related to the type of alloy, its cross-section, and its quality. Wire play. Method of ligation. Bracket placement in respect to the center of resistance of the tooth, and bracket design. Due to the play that exists between the bracket slot and archwire, when a tooth is moved within this space, it produces a loss of torque control, from which if we move the tooth labially, it produces more positive torque. If we move the tooth lingually, it produces more negative torque. In the same way, the intrusion of teeth produces more positive torque, as an extrusion of teeth produces more negative torque. The customized prescription of the Insignia SL brackets is calculated based on the final position of the teeth, T2, the facial anatomy of the teeth, and bracket placement. Traditionally, brackets are bonded on the center of the clinical crown to ensure expression of the torque prescription. If we vary the height of bracket with a stock prescription, the final torque of the tooth will be compromised to a greater or lesser extent, depending on the degree of convexity of the facial anatomy. The Insignia system allows you to place the bracket at any height without compromising the desired final torque of the tooth. This is achieved by adapting the base of the bracket to the convexity of the buccal surface of the tooth. The slot dimensions of the Insignia SL bracket are 0.22 by 0.28 inches. If we finish with an archwire size of 19 by 25, the play between the archwire and slot is plus or minus 11.4 degrees. On the other hand, if we finish with an archwire size of 21 by 25, the play that exists is plus or minus 4.7 degrees. To compensate for this play, the Insignia system offers the option to utilize customized variable torque, called torque compensation. The Insignia software algorithm activates torque compensation when the center of resistance of the tooth moves more than 1.5 millimeters in any direction. This compensatory torque is expressed on the tooth when we introduce a 19 by 25 archwire or larger. If the final archwire is 19 by 25, plus or minus 11.4 degrees of additional torque will be applied to the torque prescription of the tooth, depending on the direction of movement between T1 and T2. If the final archwire is 21 by 25, plus or minus 4.7 degrees of additional torque will be applied to bracket prescription, counteracting wire spin and leading the tooth to the planned and desired final tooth position. For example, when we expand the arches, the posterior teeth will move buccally, expressing a buccal crown torque, which can generate occlusal interferences with the opposing arch, causing difficulties in fully seating the occlusion at the end of treatment. When we activate torque compensation, we ensure the posterior teeth finish with a torque prescription without the need to apply auxiliary mechanics. Torque compensation is calculated by tracking all three-dimensional movements: protrusion-retrusion, intrusion-extrusion, expansion and compression of the anterior and posterior teeth. The archwire plane determines where the arch will be in respect to the arch, therefore determining the height of placement for the brackets and molar tubes. We should position the archwire plane toward the gingival 1/3 for the following reasons: to avoid bracket interferences on bonding day and during treatment, to provide easier access for flossing without the need to thread the dental floss beneath the archwire. In many cases, it can improve aesthetics by minimizing the visibility of the appliances, allowing them to be hidden by the lips. Torque can be achieved with less force on the teeth, as the brackets are positioned closer to the center of resistance. Now, we will review a clinical case treated by Dr. David Gonzalez utilizing Insignia SL, where torque compensation was activated. This adult patient is mesofacial, skeletal and dental class 1 open bite, with a good relationship between the upper incisors and lips. Treatment plan objectives were: close open bite by extruding the lower incisors and maintaining the vertical position of the upper centrals. Expand both arches. Apply stripping in the anterior segments to optimize the interproximal contacts and aesthetics before retracting. Increase torque of the 11 and 21. Positive or negative torque compensation is easily illustrated in the approver interface by the color of the bracket. Brackets that are gray indicate that torque compensation has not been applied, providing a customized torque prescription. Brackets that are red indicate that positive torque compensation was applied. Brackets that are green indicate that negative torque compensation was applied. If we evaluate how torque compensation was calculated by the software's algorithm, we can see that the upper anterior segment, from canine to canine, and lower incisors have a positive prescription. With positive torque compensation, we counteract any loss of torque that can occur with the extrusion of the teeth and allows to provide more positive torque to the upper centrals. With positive torque compensation, we counteract any loss of torque that can occur with the extrusion of the teeth and provide more positive torque to the upper centrals. In addition, in both lateral segments, negative torque compensation was applied on the teeth that are expanding, therefore providing a bracket prescription that will counteract any flaring that may occur during expansion of the arch.
As you have seen, the technology behind the Insignia SL bracket is truly innovative, and through my experience, I feel it is a system that provides the best torque control. In this video, I have shared many of my tips that I have learned along my journey to mastering the Insignia system. There is one recommendation I'd like you to make away from this video to ensure your success with Insignia, is to understand and utilize torque compensation.